I welcome you to this channel for well-being, prevention of diseases and prevention of chronic pain. I share my personal experience in medicine. At the same time, I also have observed these things for my family and myself, and I found them very useful. The problem of achieving this well-being and physicality to be not a barrier to the well-being is that we are not disciplined, and that discipline part needs a separate discussion. Why we are not motivated, why we are not disciplined, because the things so far I've told, they are very easy to achieve. Now today my topic is the push-ups. Now, how you do the push-ups is very important. The right technique, you have to do 10 push-ups at least every day. But you can go up to 20 or 30 push-ups. If you do proper push-ups, you really don't need any equipment. You can go, make sure your hands are the width of your shoulders. And you go down straight. And when you're going down, you take inhalation, and when you're coming out straight up, you are exhaling. Now remember, the inhalation and exhalation part should be in the rhythm of any physical activity where you put force in it, because that will help you strengthen your core muscles along with your upper body muscles. So 10 push-ups every day is a must, because that also means that you can lift your weight. That's the idea, that you can lift your weight, and that is the minimum. Now the next part is aerobic activity. Why aerobic activity is very important? What is aerobic activity? Aerobic activity is when your bigger muscles of hand and legs, they use in cycle. That means where they starts, they come back to that. Any movement that starts from a point and come back to that a point, that is cyclical movement, and that uses the oxygen in a very efficient way, and it challenges the heart. So the basic idea of aerobic activity is it challenges your heart. Now when anything that challenges your heart, it also fine-tune your sympathetic system. Now remember, our autonomic system, the system which is not in our conscious control, is the autonomic system. It has two wings. One is sympathetic activity, the other is parasympathetic activity. The sympathetic activity, which includes your heart rate, your breathing, and the flow of your muscles in certain direction, all these things are actually meant for fight or flight. Say suddenly you're going in a jungle and suddenly a lion comes. So you will either fight with it, or you will run away, or sometimes you freeze. In all those three conditions, basically your sympathetic activity goes very high. Now this sympathetic activity has to be fine-tuned. Remember, if you're not fine-tuning your sympathetic activity, the chances are you will have some kind of fears overwhelming you. The fears will enter into your life, and that might go into phobias. So remember, the phobias, the fears which actually disturb our well-being in other areas of the body, basically originate from lack of aerobic activity. Now, what is the use of aerobic activity? Not just fine-tuning the sympathetic activity, but it also burns your calories. It also keeps the blood moving into your body more efficiently. It keeps the heart healthier, and it keeps your blood pressure better. Why the blood pressure better? Because in a certain area, there are small collaterals. Say if the blood is needed, say 100 ml in 1 minute from A point to B point, and that 100 ml is available just going through that big vessel, the collaterals will be closed. As a result, with aging, those tiny collaterals will be collapsed, and this vessel will become rigid, and so your blood pressure will go up. But if you're used to aerobic activity, these collaterals are used to get opened, so the pressure goes down and your heart doesn't have to work that hard, but still it leads to blood every part and nook and corner of your body, oxygenating, providing nutrients, and taking out the poison. Actually, the poison is more important. So, aerobic activity is a must in your life at least 5 times a week. 5 times. 2 days you can take rest, but the 5 times. Now, how much it should be? Basically, you can get benefit of aerobic activity if it is 70 to 85% of your maximum heart rate. How you calculate your heart rate, maximum heart rate? It's 220 minus age. So, say if you are 20 years old, 220 minus 20 is 200, and 70% of 200 is at least 140. That means your heart rate should go at least 140. For that, I recommend that you go about 10 minutes to reach that level, and then for 20 minutes keep it at 140, and for 10 minutes cool down. So warming up, keeping maximum heart rate, and going down. If you reach 70%, that is very good, and you cannot go ahead, that's fine. But if you really want to get the benefit of aerobic activity, you can go up to 85%. If you have not done exercises for the last 2 decades or many years, and you want to start, you can start with 50%, 40%, and gradually go up. Because if you don't do gradual, you might end up having some problem. Now remember, with all these tips of prevention, you have to make sure that you communicate with your primary care doctor and tell him or her about your condition, that you are trying to do these things. Remember, an individual person cannot take all the advice similarly, but if you go gradual, chances are you're not going to hurt yourself. So that ends today the last part of our physicality, getting into a position where it becomes a facilitator of your well-being.